Hi again. I'm going to continue to talk about dementia, memory loss, Alzheimer's disease. I know we all tend to call everybody who has a little dementia or memory loss as an Alzheimer's disease. But there are a variety of reasons for memory loss, including having a stroke, where actually you can see paralyzed person, or even Parkinson's disease, where there's no paralysis, but it's a degenerative disease of the neurological systems or cells. And we also see that in microvascular disease, where small blood vessels like diabetes or high blood pressure causes circulation issue or small infarcts or small mini strokes. Some people call it TIAs, which leads to loss of brain function and leads to memory loss. So even though we lump everything together, there is definitely a distinction between different causes of memory loss. For a non-neurological person and for somebody who is common, memory loss is memory loss. And sometimes we interchangeably use the word of dementia, which is memory loss, with Alzheimer's disease. So we talked about the HDL cholesterol and its protective actions for development of Alzheimer's disease one time. This time I'm going to talk about something which is, again, common sense, but somebody has to document that the common sense does work. So there was a study which was published and talked about recently, and I'm going to mention that this time. This study consisted of approximately 2,400 patients, and there are 5 different parameters that they found or measured in people who were 65 years plus. There are 2 issues that they were trying to see. Do people with good lifestyle live longer? And do people who have a good lifestyle, do they not develop cognitive dysfunction or memory loss or Alzheimer's disease? Again, as I said, I'm using these terms interchangeably. We often say that many things that we do have an effect on our body, mind, and intellect. And a lot of things that we get as a physical illness are related to our behavior. I mean, we certainly know that smoking causes emphysema, COPD, lung cancer, and many other cancer. Alcohol causes liver disease, and so on and so forth. So in this particular group of people, they decided to look at people, and there are 5 different measures of what could be considered as a good habit. Smoking, everybody knows about it. No smoking is good. Smoking is bad. Alcohol intake. They concluded that some alcohol consumption was considered good. So light to moderate alcohol consumption was concluded as positive. Then, so smoking, alcohol. Third thing is a physical activity or exercise. Again, light to moderate physical activity was considered good. And they also concluded that doing something as a cognitive behavioral activity. This is something difficult to understand. So smoking, alcohol, physical activity, and the cognitive activity were considered. And what they found out that people who had 4 or 5 out of these activities, when they were followed for several years, they lived 24.2 years total. This is again average. And this was 3.1 year longer than those people who had only 1 parameter positive. The point is that if you live longer, what good it is if you have cognitive decline where you have to be dependent on somebody. So what they also did was they found out whether these people were cognitively more positive or improved for a longer duration of time. So they found out that those people who did not exercise or smoked or had no cognitive exercise had much less life expectancy and more years with cognitive decline. So the length of longevity was 24.2 years in people who exercised and did all this stuff that I mentioned. It was about 21.1 years in those who did not do it. And they had a significant decline, 20% had cognitive defectiveness when they were not following the standard care that I said to you. So my conclusion is what we knew was confirmed. It is good habit to exercise. It is good habit not to smoke. It is good habit not to drink excessively. I'm not sure if not drinking alcohol adds to the problem or not, but certainly a light to moderate alcohol intake was considered good. Again, the physical activity or exercise in moderate exercise was protective. If you remember, I had talked about event memory and aerobic exercise. This was in my video also. That also seems to show that these types of exercises caused improvement in event memory. And in fact, they had measured the hippocampus volume and they found out that it was improved. So to me, this is the common sense studies to prevent Alzheimer's disease and live longer without cognitive decline. One needs to do exercise, if it is aerobics, and if it is moderate, that helps much more than if it is minimal. Number two, no one needs to smoke. If you are non-smoker after age 65, that helps to improve longevity and improve possibility of getting Alzheimer's, which means it is decreased. Alcohol intake, another important factor. Excessive drinking does not help. And HDL cholesterol, if the HDL cholesterol is increased, then it has some protective action. And aerobic exercise also causes people to retain event memory. So essentially,